Ever wondered how antifungal drugs work? They're fascinating, and they come in several classes, each with its unique way of combating those pesky fungal infections. First off, we have the polyenes. These clever molecules bind to a substance called ergosterol in fungal cell membranes. This binding leads to a disruption in the membrane and ultimately the demise of the fungal cell. Notable members of this class include Amphotericin B and Nystatin, often used for serious systemic fungal infections. However, they do come with a caveat: potential for nephrotoxicity and gastrointestinal disturbances. Then we have the azoles. These work differently. Instead of attacking the cell membrane, they inhibit a particular enzyme involved in ergosterol synthesis. This action prevents the formation of ergosterol, thus disrupting the fungal cell's integrity. Some common examples are Fluconazole, Itraconazole, Voriconazole, and Ketoconazole. They're handy for a range of fungal infections from superficial to systemic. But beware of potential hepatotoxicity and drug interactions. Next up is the class of echinocandins. They inhibit the synthesis of beta-1,3-D-glucan, a vital component of fungal cell walls. This action weakens the cell wall, leading to the fungal cell's death. Caspofungin, mycofungin, and anidulafungin belong to this class, and they're especially useful for invasive candidiasis and aspergillosis. They're generally well tolerated, but some may experience histamine-mediated reactions. The allelamines, such as terbinafine and naftifine, inhibit squalene epoxidase, another key enzyme in ergosterol synthesis. They're particularly useful for dermatophyte infections like onychomycosis, and usually they're well tolerated, although rare cases of hepatotoxicity have been reported. Last but not least, we have flucytosine. This drug is converted within the fungal cell to 5-fluorouracil, which disrupts both RNA and protein synthesis. It's often used in combination therapy for systemic fungal infections, but it comes with its own set of potential adverse effects, including hematologic toxicity and gastrointestinal disturbances. Of course, it's important to remember that individual drug contraindications may vary, and general caution is needed in patients with known hypersensitivity, liver dysfunction, or renal impairment. Remember, these are just broad strokes. Specific drugs within each class may have unique properties and considerations. Always consult a healthcare professional for personalized advice and accurate information. Antifungal drugs, a diverse group that works in various ways to rid us of fungal infections. Now you know a little more about how they do their job.